Hi, my name is Tim Donahue. I'm an electrophysiologist at Duke Regional Hospital. I work with Triangle Heart Associates. One of the main things that I like about electrophysiology is that you can fix problems. I love it when patients are rid of a problem that they've had for a long time, and we've essentially cured that problem, and I tell them that this thing that's sort of plagued you your whole life, you don't have that anymore, and you can go do whatever you want. You don't have to worry about seeing a cardiologist anymore. There was a lady who I have been seeing since before I was with Duke. Before I was with Duke, I was at the Ochsner Clinic in New Orleans, and she continued to see me once I moved to Duke and drove about 4 hours each time to come see me from Tennessee. She had an SVT, which is a rapid heart rhythm. And I'd seen her for about 10 years now, and she finally decided that she wanted to do the ablation procedure to get rid of it. So we talked about that a lot. She was very nervous, and then she came in one day and we were able to do the ablation procedure and get rid of it. And I just saw her yesterday in follow-up, and she was just thrilled and amazed that she was finally rid of her SVT and that it wasn't going to happen anymore. And she was very happy. And now I told her she can, come in if she wants to go to lunch, but otherwise she doesn't need to see us anymore. Patients can go anywhere in the area to any Duke clinic, and that clinician can see all of their records, whether they were hospital records or whether they were outpatient records. All those things are easily available to the clinician. Tests don't need to be repeated because I can see tests all the way back to 2001. If a patient had an echocardiogram, I can see that. I have a wife and two boys. We spend a lot of time together. We hike, we go skiing, we get out and play soccer in the front yard. So at the end of my day, that's what I do each day is find those boys and get everybody out and get everybody active.